Pleasure hearing from you.
Yeah, likewise. Thank you for reaching out. So how do you want to do this? I mean, I guess you're saying that, coming on video and being a full up guest and everything, the hospital or whoever you work for is going to get annoyed by that.
I would believe so. Correct.
Mm-hmm. So,
because it's not probably my view on just taking care of the patients. I guess it's probably my view on, the greater agenda of, I think a lot of your guests and yourself and myself see this as something more than something accidental. We see this as something planned and something that's going on, and it's due to control people.
Mm-hmm.
And that's part of, I think, something that they wouldn't like to hear.
Right?
I'd like to talk about more than just this virus. I think I really enjoy your show. I love the variety of guests that you have. I think there's another thing that I think we could talk about that's kind of interesting.
What's that?
About this control aspect of this virus, and part of it is medical care and how medical care has kind of like compromised our country because people are handcuffed with healthcare problems and healthcare costs, and this is a way of controlling people and a way of creating fear.
Right.
That has been going on for a long period of time. So I don't know if that sounds interesting to you or not.
No, definitely it is. And the thing that I've observed, I just think that people who have kids feel like, well, I can't be confident enough in this. You can disbelieve the 9/11 story all you want. Nothing's going to happen to your kids. If you say, I don't believe this coronavirus story, and then something happens and your kid gets sick because you behaved in a way, people just feel that they can't do that. So they're really hitting people psychologically with this. So what have you observed? You're a nurse, you said, right?
Correct. And I've been a nurse for almost 30 years. Mm-hmm. And I work it's like a USA Today top-ranked facility. Mm-hmm. And I work in a medical ICU where you see infections all the time. I've seen the H1N1 virus when it came through. I worked in this facility at that time. Mm-hmm. And I'm around people that get awful infections. A lot of those people are, for the most of the time, and this is what people don't understand, that a lot of people that really get sick from these infections are not normal people. These are people that have other existing conditions. They don't have normal health problems. So we have a huge problem right now of people that have autoimmune diseases, the people that are transplant candidates or transplant patients. We have people who have...
So, but wait, why do they have from the transplant, they're taking drugs that suppress the immune system, and that does it, or?
Correct. Yes, correct. That affects your ability to fight these viruses.
And there's probably more transplant patients alive today than ever before, I would presume.
Correct. And the amount of autoimmune diseases that are out there is off the charts.
And that's due to chemicals in the food and the 5G stuff that everybody's worried about. Everybody's subjected to all these different stressors that can stress the immune system.
Right, but I don't think 5G, I don't know. I haven't done any research to convince myself that 5G is part of the autoimmune problem that we have. There are a few different things that really cause autoimmune problems. One of them can be viruses can cause autoimmune problems. Mm-hmm. Another thing is a thing called the permeability of the digestive tract, called leaky gut syndrome.
So that's all the Monsanto stuff that people are eating fake food sprayed with chemicals, and who knows what that does.
Correct. And not only that, but it's also an imbalance in our digestive tract with foods that are in much different proportions than what we used to have. Things like the amount of sugars that we consume, things like ibuprofen, things like antibiotics, all these things change our digestive tract, and it changes the permeability. And the other thing, too, there's reactions to vaccines where people have autoimmune problems.
Right.
So, we'll create even more problems by giving people vaccines, but people, they don't want to, they're squelching all of the any type of information about vaccines, any any anti-vaccine information, they always want to suppress. So...
Yeah, we saw that in Del Bigtree's movie, definitely. And see, that's what it comes down to for me, is that when we have evidence that the CDC and its previous directors have been corrupt to the extent that they would suppress a study so that a person can earn money, I mean, that in my mind creates a picture of an organization that I would never, ever, ever trust. And somebody sent me a really interesting article from John Rappaport. He's talking about these tests. We're hearing endlessly about the tests. And I got to tell you, my ears perked up the other day. You know, we're hearing 33 people in this county, 33 people in this place, 33,000 Chinese detained. How do we know? These are numbers on a page. You're sick in a hospital and somebody comes in there and tells you have H1N1 or you have the flu or you have coronavirus. You're not going to know.
Right, until they get tested. But I do think this is different because I think this, like you said, coronavirus is just the common flu. So I think what makes this different than the common flu is if this was created in a lab, then it's a virus that we don't have antibodies to, so we react differently because we don't have a history of a reaction to this particular one or a strain of it where we already have antibodies to it. So this is like a brand new one, a brand new coronavirus that's really, and it's going to affect people that are immunocompromised or people that do have a poor reaction to the flu at baseline,
right?
If that makes sense.
Yeah.
So somebody that, let's say if I get the flu and I don't miss work, but all I feel is a little sick for 3 or 4 days, it's different than someone else getting that same exact flu
being
and
in
being
bed
off
with a
work for 2
fever
weeks and getting an inhaler and having those type of reactions to it. So,
So, okay, so you're a nurse, you're in the ICU. How many coronavirus, and can you tell us without compromising or tell me without compromising where you work? Like, you know, East Coast, West Coast, can you tell us the state? Like
Midwest.
Midwest. And so how many confirmed coronavirus patients have you seen or interacted with or become aware of?
Aware of just 2.
And by aware,
how
do you become aware and how do you personally know or confirm that
they actually they swab the patient's respiratory secretions and they send them to the state lab, and then the state lab gets the results back if they're positive or negative.
And how often are these type of medical results incorrect? False positive, false negative?
They're, I would say, rarely false positive. I would say it's more common to be falsely negative. So if you swab a person incorrectly, then if you don't swab them correctly, you're not going to get enough of the virus to know that you have it. Or if you don't go in far enough, because it's a nasal swab, what we use for the regular flu.
Sounds like, really unpleasant.
Influenza A. Yes.
Just sticking a Q-tip way down somebody's nose, like back to their throat, through their nose.
You use 2 Q-tips. You use one, which is called like a scraper that's bigger, and you go into the nose and clean out the common crud of the nose, and you take another one that's a smaller diameter and go like twice as deep as the first one.
How do patients react when you do that test to them?
They do not like it at all.
Right. It sounds terrible. And people are running out, shoving these things up their nose. Okay. So you can't, there's no way, you can't just like put a Q-tip at the back of somebody's throat or prick their finger with a little pin and take their blood. Why do we have to stick this thing all the way up somebody's nose?
Because that is where the virus lives. Because it wouldn't be, so like you have a systemic infection, which means it's in the bloodstream. That won't show up as a virus. That's a respiratory infection is going to show up in a sample of fluid from the respiratory tract. So that's why it's different. So if you were to get, let's say, a cut on your finger and you couldn't seek medical attention, and that bacteria went into your bloodstream, that is when you would do a blood sample. But a respiratory infection is something that you're going to check with we're going to get respiratory fluid and check it in that manner.
Well, let me ask you this. Because again, it's difficult for me, it's difficult for any lay person to evaluate. There's so many, whenever you get into a field as complex as medicine or even far less complex than medicine, there's so many subtleties to something. People hear on the news, this person tested positive. I imagine there's got to be numerous ways in which a test sample could be corrupted to the extent that something gets in there that gives a false positive. Or what about the possibility that somebody has just the flu, which a year ago, if they got it, someone would say, oh, you have the flu, and they'd be home for a week and no big deal. But could that flu show up as a false indication of this pandemic?
No, because they're usually able to differentiate the different types of flu. So you have, like, let's say influenza A, or you have H1N1.
So are you feeling like these two people that you are aware of who have coronavirus, are they the average person walking around on the street, or they were immunocompromised in some way?
They're both immunocompromised. They're not normal people. I've been doing like ICU nursing for over 20 years, and we rarely ever see, besides corona, the flu period. We hardly ever
in an
see
ICU
regular flu patients in the ICU. They always have another problem that puts them there.
Got it.
So it's not normal people that end up in the ICU. And these people that say, oh, there was 3 people that were under the age of 50. It doesn't matter. We have people that are have all these health problems.
Right.
Yeah, that are young. They're not old.
Yeah.
I mean, we have a huge problem with younger people. That we're not really a very healthy country.
Yeah,
we have to spend all this money on medicine,
smoking, right?
But it's not. It has nothing to do with health,
right? Right. I mean, yeah, I have a friend, unfortunately, who died in his 50s of leukemia, and obviously we would add to the list of immunocompromised people anyone who's undergoing chemotherapy or cancer treatment or, any of these kind of things that they can't leave their house because they're fearful of getting sick. So you're in the ICU. Obviously, you're a nurse. You're very likely not afraid of coronavirus and getting sick, right? Or are you?
Correct.
Not afraid.
No, I'm not. In fact, I would think if we see enough patients, so the problem with me, not actually the problem, but the chances of me getting the virus is probably going to be high because incubation period is very long without having symptoms. Mm-hmm. But since I don't have issues with viruses in the past, but when I get them, they do not cause me to be off work or to be sick, for very long, that I feel confident that if I would get this virus, that it would not be a life-threatening condition or would not cause me permanent injury.
Yeah, and other people should be aware of that. If they're not in this immunocompromised category, their risk of death or permanent health damage from coronavirus is pretty low.
Correct. Mm-hmm. And we want to focus always on the negatives instead of on all the people that, the positive outcomes. And another issue with this too is, and this is always follow the money, is that, we look at health in kind of a different way. So in America, it's like if you do not have a study that is funded to prove that something works, that means it doesn't work.
Right. And who's funding it is usually the person who wants to sell it.
Exactly. So if you have a product that would work, but you can't patent it, it's not going to be promoted. And if it's not promoted, then if somebody mentions it, they're going to say, you're just some person you're some whack job that believes in anything.
Yeah.
You believe in stuff that hasn't been studied. And it's like, well, it doesn't want to be studied because it's not for the good of the people. It's just before the profit motive.
And I see a lot of that.
So there's a product called Sambucol, which is the elderberry extract, which was studied in Israel for the flu virus, and it proved to be more
efficacious,
effective than Tamiflu, but you couldn't patent it.
Huh.
So you can't sell it for $75 a pop like you can sell Tamiflu.
Right.
If you can sell for $75 a pop and make $1 billion on it, I guarantee my last buck that they'd be trying to promote it.
Right. Yeah, I mean, this
whole patent and research model that we have does not benefit health. It just benefits the profits of corporations trying to promote products that they can make money on.
Well, it's also setting a scary precedent because they're talking about vaccines right away. They started talking about vaccine. Trump even said this is the fastest development of a vaccine ever. It's like, oh, please. I mean,
and then what about the people making the test?
Well, right. What about them?
Yeah, and who? I mean, was this already? Oh, I just happen to have this investment in this company that is going to make masks or is going to make the vaccine or
Right.
all these pre-known investments that they put money into because this was going to happen.
Yeah.
And it's like the people that shorted airline stocks the day before 9/11.
Right.
Where did that investigation go?
Yeah.
But part of the problem is that we have dumbed down society through schools to, that we don't even know what health is. I mean,
Right.
health is not access really to healthcare. Health is the absence of sickness.
Right.
And as long as we have a system that wants to treat symptoms
Yeah.
instead of preventing problems. And, people say, well, we're entitled to health care. It's like, well, if we really cared about health, then we wouldn't be eating
Right.
fast foods.
Exactly. Why not
tons
make
of sugars
hydrogenated oil illegal? Why not make high fructose corn syrup illegal? Say this is a food additive that is banned in the United States as it is in other countries. Those two steps alone would probably, on a societal scale, move the needle on improving overall health.
Yeah, there's no common sense with.
There's no common sense.
Because there's not the financial incentive. It's still follow the money.
What would you say is your overall view here? Is this going to be societal collapse from this coronavirus, or is this just an absolutely media-driven reaction to a possibly unusually strong seasonal flu type virus?
Well, if it's going to affect the financial markets, then this could be a partial financial collapse. Who knows how far it could go? It's just hard saying. It's hard saying where this could go financially because of, like you said, all the people that are going to file bankruptcy. They're going to lose their savings. They don't have income coming in. I mean, it's always we have the other issue too is that our system is created. We have a debt-based economy, and and that's created by the Federal Reserve. And the Federal Reserve is, to me, the Federal Reserve is just a part of the global banking network that's used to control us. That's all. I mean, they're inflating the cost of everything, and they don't care. I mean, it's their incentive to loan money. I mean, they don't care about anything else. As much as I like Trump, I mean, there's some things that I don't understand about Trump. Is like, how can he have Wilbur Ross in his Secretary of Commerce?
Right.
I find that very disturbing. And Mike Pompeo and Gina Haspel.
Right.
Gina Haspel, she's in Iraq, overseeing the torture of Iraqis. I mean, This is unbelievable. It's just very sad.
Yeah, it is. I agree with you on that. And I have to say that I'm feeling that feeling much more right now during his response to coronavirus. I mean, obviously I'm disappointed that he hasn't done anything to get Julian Assange out of prison. I'm disappointed that he hasn't pardoned Flynn. I'm disappointed that he allowed the Justice Department to let McCabe skate. I'm disappointed that he hasn't #locked her up. So, I don't know. I feel like we're getting pretty close. This is like the 9th inning of Trump's first term, and we need a home run here to bring it all in, or it's not going to go that well. You're talking about the Federal Reserve, and it's interesting because we've heard in the past, day or two that the airlines are looking for a bailout, and Trump even said in his coronavirus press conference that he's definitely going to help the airlines. I'm seeing right now casinos are asking Congress for a bailout. I mean, that is outrageous. You ever lose any money at a casino and go to the cashier and ask them for a bailout? They don't do that.
Yep.
So I mean,
welfare,
I don't see the cab drivers, the restaurant owners, the movie theater. I don't understand, first of all, how a movie theater in New York City stays open in 2020 at all. And now you're telling me it's going to close. Even if they opened them tomorrow, that business is not coming back next month. And you're going to tell me, you look at the size of a movie theater, you look at the rent per square foot in Times Square, and you're telling me that theater is going to stay closed for a month and somehow be able to pay the rent, particularly when Disney now is rushing all these movies to streaming services so people can, quarantine and chill and sit at home watching movies? How is the movie theater business in a city like New York, a city like San Francisco, how is it going to last through this? Till August? There's no way.
Yeah. My biggest thought process on the whole thing is they want to change the dollar as being the world currency, and they want to go to a world currency base probably through the World Bank.
Something new?
Called I'm trying to think of what's that called.
The IMF.
The IMF. And they're already using it. They're already practicing with another currency. And I think everyone would probably keep their currencies, but their currency would be weighted against the global currency. So I think that's the big push is to crush the American economy and say, well, we need a global currency because this is a solution to our financial problems.
And if everyone's in the grip of fear from this disease that they think they're going to get, they'll basically, this is like the Patriot Act. You're so rattled by the event that just whatever comes next, as long as someone authoritative says this is what we're doing and goes forward boldly, a lot of people just say, okay. So, all right, well, we're not going to use your name. We're not going to say where you work, but you're a 20-year ICU nurse working in the Midwest of the United States, and you have not seen your hospital overrun by coronavirus victims, nor do you feel today like it's necessarily. We heard there's going to be this exponential explosion of patients. Does that jive with what you're seeing at your hospital?
There could be. There could be an exponential patients, but it's going to be patients that are not of normal health. It's going to be patients of people that are going to have they're immunosuppressed for whatever reason, or they have a poor response to viral infections in the past.
What about kids? We're hearing now that kids and young people are getting it too.
There's a possibility. I mean, part of it has to do with health. How healthy is the foods that we're eating to fight an infection? If we're not eating things that are fresh, vegetables or fruits that are fresh, because there's supposed to be a lot of properties in these types of foods to help fight infections, and how much of that is part of our diets.
Right.
And then I don't know about you, when I was growing up as a kid, there were not these food allergies that we have with kids now. These kids I see now, they're kids in high schools that are on insulin dependent diabetics in high school.
Wow.
I mean, there's a huge population of kids that are not very healthy, and that puts them in that same category. It's really not what your age is; it's how healthy are you really when it really comes right down to it.
Yeah. No. Absolutely. And so, what do you recommend? What's that?
So what I recommend, I think people that have immune problems that don't do well with viruses, the flu in general, is not to go out for a while, is to limit their exposure in large groups. And people that are relatively healthy, I think it would be safe for them to go out, but to go out, keep their distances from other people, and just practice realistic, healthy habits that, washing hands, keeping your distance, don't shake hands, things like that, where you're going to contract the virus easily. So I think there's a theory called flattening the curve, where I think we're all going to get the virus, but if we get the virus over a more gradual period of time, the people that will need hospitalization won't need it. There won't be that spike in need, because there's only a certain amount of ICU beds available to help these people. And hopefully that we will slow the amount of patients that need ICU beds down, so there won't be this problem.
Now, I just want to clarify, because when you say everyone is going to get the virus, or almost everyone is going to get the virus, and then a second later you're talking about ICU beds, people's thoughts immediately go to, I'm part of everyone and I don't want to be in an ICU bed. So when everyone gets the virus, not everyone is going to get sick from the virus, correct? We have a lot of viruses in our bodies at all times, don't we?
Correct. And a lot of people, I mean, I think some people they don't even know it, but they've already had this virus.
Right.
And they didn't, and they weren't tested for it, and they've already overcome it.
Yeah.
I know some people say, I mean, I think I've already had this because I've had this flu. It's a lot different than the flu that I've had in the past.
Mm-hmm. How is it different?
It's just stronger. You have your body has a more difficult time reacting to it. You have a lot more aches and pains. Your temperature can be worse. Your breathing can be much more difficult than with flus that you've had in the past. So,
but then again, you're older, and it's a different time of year, and you're getting bombarded with all this information that's going to make you nervous if you have it or not. So again, we don't know, right? It could be, if someone got the flu right now and it wasn't coronavirus and it was the flu, don't you think a lot of people would say, oh my God, I've got coronavirus?
Maybe not, because I think their reaction, since you've already had similar flus in the past and you've had them, let's say, from last year, you're still carrying antibodies that from the previous episodes of infections, that your body reacts to it, and your response to it is very good. So if your response to it's very bad, then you would think that this is a flu that you really haven't been exposed to before. After you're no longer contagious, then that's when things will be better. When more and more people have had it and they're no longer contagious, then it will be safer to be around those that that are at risk.
You've just raised another point that I wanted to ask you about, because it reminds me very much of when George W. Bush, when we had the blackout in New York in 2003, and immediately they came out and said, well, we have no idea what caused this, but we know it wasn't terrorism. And I say to myself right away, well, how the hell do you know it wasn't terrorism if you don't know what caused it? If some terrorist went and blew up some very strategic component of a power station and knocked out the whole grid, that would be terrorism. So we heard from a doctor who appeared, not Dr. Fauci, a different doctor who was with President Trump at the press conference, that one of the things that they were confident that they knew was that people are still contagious even when they're not showing symptoms. Now, this struck me as, again, I'm not a doctor, I'm not a scientist. I presume there is some way they could know that, but how do they know that if there's so many other things about it that they're admitting to not knowing? How do they know that people are contagious when they're not showing symptoms? Because to me, that seems like something you could put out there in the public that would make people extra super paranoid about this. Because I didn't even know I'm sick and I could be giving it to people. I better stay home and not go to my job and close my business and ruin the economy. How could they know?
Well, I'm not sure. I'm not sure how they determine that. I'm sure there's a way they can measure the virus shedding from us during those times that they have equipment to test that with. If they're not showing symptoms, I mean, that just shows that person that has it is not really being affected adversely by it. I mean, and that's a good, in some ways, that's a good thing, because people always want to compare everything to the flu from 1918, the Spanish flu, and that was so much different because that had different parts of it that really I haven't seen repeated since then. The cytokine storm was like the major factor which caused the death, which is, all these cytokines that your body, the proteins in the body that your body releases, and those proteins, they become in such high number that they actually cause inflammation and plugging of, organs in our body and our circulation. So, and for some reason, we have not seen really a flu like that since then. And I'm not sure if that is because there's more global travel and we see the flu more often. And it seems like the more often that you do get sick, the easier it is for you every time a new infection comes around. to fight that infection because you already have, your body's already practiced fighting an illness.
Right. I mean, I would think, as with any, disaster, there had to be multiple contributing factors in that 1918 flu. Like, certainly medical procedures were nowhere near as advanced as 100 years ago. So, I mean, they didn't know anything about virology or even how to conduct a hospital compared to today. Back then, I don't think you had, Well, but anyway, I mean, the point is, here we are now, and people are worried, businesses are closing, the economy is already being impacted tremendously. And I mean, we're kind of in a situation where there's a lot of damage that's already been done. So I think now what we need to do is hopefully get on track and get back to normal as soon as possible. What do you think about the reports that we're hearing that China is already getting back to normal? We've been hearing, worst case scenarios where everybody in the country is going to get sick and this is like a world-ending pandemic, but it seems like a month or two and China's already, things are looking good.
Well, number one is, do we know when this virus really started there? Did it start in January? Did it start in November? I mean, if it started in November, and we really didn't know that it started in November, but actually, let's say it actually started at that time frame, is it the possibility that it has affected a lot more of the people than what we realize? So once you get a certain amount of people infected, then your bell curve goes down on new people that get infected. So there might, and there's also this theory too that this virus is targeting Japanese males, or not Japanese, Chinese males.
Right.
And, and is it in all reality, maybe that Chinese men smoke more, and that is the reason why they're being affected more. And let's say older Chinese men have smoked for longer periods of time.
Right.
The longer you smoke, the greater you're at risk.
Because it affects respiration. So in other words, someone who is a smoker and has compromised respiration already gets this sickness, and that leads to other complications.
Correct.
Now, there's one other thing I wanted to ask you, though, about people who have the virus and could transmit it but aren't showing symptoms. Because, symptoms might include coughing, sneezing, etc., and it's easy for a layperson to understand how doing those things would shoot out, virus, mucus particles. You sneeze, you spit. So some idiot spitting on the street the other day. That's obvious. But if you have this virus inside your body, like every person walking around has, all kinds of viruses in their body that their immune systems are constantly keeping under control. Otherwise, we would all be sick all the time. And so if you're not showing symptoms of sneezing, coughing, whatever, unless you lick your hand and rub it on somebody, how are you transmitting that virus to them?
Oh, just, poor hygiene practices. You're really not going to be, but if you are in closer contact and breathing on them, and you're shedding the virus that way. So, and that's where they say the distancing is kind of important. And we do some things out of habit that we don't realize. Coughing into our hand, and then, the person not washing their hands, or
right.
and then touching door handles and knobs, and the refrigerator door or a drinking fountain. All these things just they transmit really easily. So that's the problem. Another problem with this virus is it seems to have a really high transmission rate. I mean, the amount of people that it can transmit to is very high.
It remains unclear to me how that would be the one thing they know. It's just strange that the one thing that they know for sure about it is the thing that puts the most fear and doubt into people's minds. You don't even know if you have it, and you're giving it to people. Well,
and that's the other thing too, is that, is this, how honest are they saying that this 14-day window that they have, they can be transmitting even though they have symptoms? It'd be interesting to interview 100 people that tested positive and then ask them, when did you feel symptoms at all, or when did you start feeling symptoms? And it really doesn't help us. We don't know when they were tested and what portion of the thing, because if you're not having symptoms, you're not going to know to be tested.
Right.
So
it sounds to me like the net takeaway from our conversation is that your personal experience in your personal facility does not reflect an imminent overload of that particular hospital.
Correct.
All right. Well, I appreciate the call.
But it's early.
Yeah, it's early.
It is early, and it's we don't know how many.
But if China recovered in 2 months or something,
Right.
I mean, how far?
This is March. This is like if they started in November, and this is almost the end of March, then that's 5 months time frame. So we're not really sure. We really don't know when China's really started. I mean, these are some real gray areas of when some of these, some of this whole situation started over in China.
Sure. All right. Well, we're going to watch and see. It's, for the most part, out of our hands. All right. Well, thank you. And thanks for watching the show. And, best of luck to you.
Yep. Thanks for having your show, Joyce. It's a real good one.
Take care. Bye-bye.
Take care.